Okay, I'm going to have you cover your left ear. Okay, I'm going to whisper in your right ear, and I want you to repeat what I say.
Cat, dog.
Okay, good. Now cover your opposite ear, and do the same thing.
Okay. Dog, bird.
Yep. Okay. And now I'm going to use the otoscope here to examine your ear. Okay, can I have you tilt your head a little bit to the right? Now I'm pulling up and back. I'm going to be doing this wrong. I'm going to brace with my left hand so that if she would move her head, this wouldn't jam in her ear. Okay. And I see the tympanic membrane looks to be pearly gray and just a little bit of wax. Otherwise, appears normal. Now I'm going to take a look at your nose. Your nose appears midline, doesn't appear to be broken. Have you ever had a broken nose?
Not that I know.
Okay. Now I'm going to clean off the vacuum and change it. And I'm going to take a look up at your nose. Okay, can you tilt your head back? Okay, now bracing the top of her forehead. And looking at both sides. Everything looks clear, it just looks red. Now I'm going to take a look at your mouth, taking a look at your lips, which they just seem to be a little dry. Are you able to just open your mouth for me so I can look? Okay, I'm just going to use the tongue depressor to look. Open wide. Okay. Everything looks good. There's no white patches. Everything's pretty much pink and moist. Okay, can you stick your tongue way out for me? Okay, the tongue comes straight out. It doesn't deviate left or right. I'm going to test your gag reflex, okay? Be able to... Okay. And can you stick your tongue out one more time? Can you say, ah? Okay. And let's go there. Dispose of that. In the garbage. Okay. Now I'm going to take a look at your neck. Everything looks symmetrical there. Had any problems with your neck ever?
No,
Okay. Can you shrug your shoulders for me? Okay. And can you put your, right here, and your left. Okay. Now I'm going to palpate your carotid artery. You have a really good pulse there. I'm going to listen. Excuse me. Thank you.
What's a listen?
Now I hear. Okay. And your trachea is midline. Okay, can you stand up for me? I'm going to attempt to palpate the thyroid, which I shouldn't actually be able to do. Can you swallow for me? Okay. Ooh, sit back down. Okay, I'm going to palpate your lymph nodes now. Seem like you have any enlarged lymph nodes, which is good. Okay, now I'm going to take a look at your upper extremities. Just want to look at your arms, and everything's good. Have you ever had a broken arm?
No.
Okay. For range of motion, can you just lift your arms up for me? Okay, good. Back down. Okay. Can you put your arm like this? Okay. Okay. Now make like a
Flex?
I do want you to flex. Okay. You have good right there. I just need to assess your brachial pulse here. Okay, and your radial pulse. Okay, both are strong. Can I have you stand up? And I'm just going to check your back. Have you ever had any back problems?
Yeah, I had a compression fracture before.
Okay, how many years ago?
Like 4.
Okay. I'm just going to palpate your spine. Tell me if you have any tenderness. I'm just going to palpate to the sides here. Does anything hurt? Okay. Okay, now I'm going to check for the CVA tenderness. And what I'm doing is putting my hand here on your side, and I'm going to hit my hand with my fist. Tell me if you have any tenderness there or any pain.
Okay.
Okay, I'm going to do that on the other side. The other hand.
No.
Okay. Good. Okay. I can keep you standing here, okay?
Okay.
I'm going to check your lungs here. What I'm checking for, I'll have you turn so you can see, is for respiratory expansion. Can you just take a deep breath? Okay. My fingers expanded equally. And I'm going to listen to her lung sounds. I'm going to try and not pull your shirt up, but we would not listen through the shirt. Deep breath. Sorry. One more. Okay. Just keep you standing there for a second. So she sounds clear. And I can have you sit back down. Okay. I'm just going to check the front of your chest here. Your respirations. We've observed for a full minute in respirations. Just to keep this short, she's approximately 18 right now, but I would observe for a full minute. I'm going to next listen to your apical heart rate. We would also listen to this for a full minute. Sorry, I can't hear. I'm also going to listen to your lung sounds on the front, okay? Take a deep breath. Okay. Sorry, I didn't mean to move your shirt so much. It's cool. Okay, now I'm going to listen to your 5 heart sounds. We're going to start with the aortic valve.
Okay.
And then we're going to move to the pulmonic. This is once again basically the apical. Down a little further is the mitral. Over to the right side is the tricuspid, I'm sorry. Okay, she sounds good. We're actually listening for any murmurs or any irregular heart rates. Okay, the next thing, I'm going to talk to you about breast examination. Do you examine your breasts every month?
No.
Okay, you should examine them monthly, usually around day 4 to 7 of your period.
Who is that?
What you're going to do is palpate each of your breasts in all 4 quadrants, going around hand over.
So like this. Okay.
You're going to make special attention to the outer portion because that's where a lot of tumors are found. You're also going to palpate your nipple, see if there's any discharge. So yeah, you're going to want to do that monthly, day 4 to 7 of your cycle. And can I have you lay down? I'm going to look at your abdomen now.
Should I do that breast examination in the shower?
Oh yeah, do it in the shower. Because that's when the skin is nice and smooth. Okay. So I'm just going to take a look at your abdomen. Can I lift up your shirt? No. Okay, well, I have an unwilling,
You don't need to go under the
unwilling
clothes.
participant. Everything looks good from what I can see through your shirt. We're going to auscultate for bowel sounds now, starting in the right lower quadrant. This I am going to go under for, okay?
I'm